clinic. This was for some of the data that allowed them to enter the clinic initially. So the question was, could we put a molecule on the surface and target the device? This is when we were more naive and thought our targeter was doing everything with the device, right? So we asked that question. We put folate on the surface of the dendrimer devices. We injected them in a KB cell model. The KB tumor cells are cells that have high levels of folate receptor on them. So if you have a folate ligand and a tumor that has very, very high levels of folate receptor, you'd expect to see them target where the tumor was. The trouble with folate as a agent to use in the clinic, right? This is very useful for we only used it for proof of principle ourselves because we thought once you got in the clinic it wouldn't work because there's folate receptor all over the place in the body, right? And to get the right therapeutic ratio between a tumor and the body could be problematic. I mean, this tumor line was picked specifically because it had high folate receptor, but other tumors aren't necessarily going to have that at all. So this is more a proof of principle of having a ligand and a target, and could you target it and prove that you could target the nano device, right? And then, so this was published a few years ago. We showed we could actually target the nano device, a 5 nanometer device carrying folic acid, right, on the surface, folate on the surface to that tumor. This is the tumor tissue, isolated. And in fact, if you isolate all the other organs in the paper, we showed that the amount of uptake correlates with the amount of folate receptor in the other organs in the body. But the tumor was the one we wanted to look at more closely. And if you add free folic acid, right, you can compete off the binding of the device, again showing specificity. And then the exact device, as best we could characterize it chemically, the exact device without folate, right, didn't bind or bound at a very low level. So we showed some specific binding of targeted